A very good day to all interviewers and doctors. My name is kimhooifang and I'm a medical officer working in Hospital Beluran, Sabah. Today, I would like to present a topic regarding the use of social media in emergency medicine education. First of all, I would like to begin with some introduction. Social media is the bread and butter in our daily life, and it creates interactive digital platforms that are used to share information and ideas through words, graphics, or videos. It plays an important role in medical field. And I would like to discuss about the advantages and disadvantages of social media in emergency medicine education. First of all, it is very convenient and easily accessible as all the informations are readily available online, and we only require electronic gadgets such as mobile phone, computer, iPad with internet access in order to search for all this information. Secondly, it's able to reach out to many people as all of us get to access to the sharing platforms at any given time, and it allows us to carry out discussions and interactive communications. Next, it's definitely more fun to learn from social media rather than textbooks. Graphics and videos are definitely more interesting compared to the long text, and also they allow better understanding as well. And we can also solve this quiz on mobile apps, and those quiz and also question solvings, they actually bring more fun to the learning process as well. Next is definitely more cost and time saving, as useful information is just one click away, and we don't have to spend so much money on expensive medical books. Distance traveling is not necessarily as well in order to attend to the conference or workshops, and through this we are able to save a lot for transportations and traveling expenses. Next, I would like to move on to disadvantage of social media in emergency medicine education. First of all, misinformation might occur, as some of the information they are from unreliable sources, they are outdated, or they are actually being conveyed by untrained and non-professional educators, and this might lead to misinformation. Next, excessive use of social medias will decrease face-to-face communications, and this is actually not that effective for teachings that involve procedures, hands-on or surgical skills, as face-to-face interactive learning and bedside demonstrations will definitely be better to provide better understandings in such conditions. And next, lack of emotional connection might be occur as well between the two people, as in order to build rapport, we need physical interactions. So next, I would like to discuss about some emergency medicine educations that can be conducted to healthcare workers or public or patients. For healthcare workers, for example, we can learn some international guidelines, CPG, and procedure, surgeries, disaster management, and also COVID pandemic SOP. For example, like how do we triage the patient, how do we place the patient and assess the patient, SARI patients or patients who collapse, and these are all can be learned through social media and through sharings between each other. Next, public and patients usually will convey the information in layman terms so that they can understand better. We also have forums, websites, which allow professional doctors to answer questions asked by the public, and also we can educate them how to react and respond in emergency situations, such as how to perform first aid and some maneuver, and how do they recognize red flags or emergency signs and symptoms if they have any chronic illnesses, such as in the case of fleeting or exacerbation of bronchial asthma, etc., so that they can carry out the first management by themselves effectively. So next, I would like to move on to types of social media. Here, I'm going to highlight some of the commonest platforms that are widely used by Malaysians. And first of all, we can see Facebook, Instagram, YouTube, Twitter. And here are some examples of some Facebook groups and page which allow knowledge sharing and case discussion. And here, this is a YouTube channel belongs to emergency physician from USM, Dr. Arif, and he uploaded many videos regarding emergency medicine teachings, and I found it very, very useful. And also some medical related educational websites which allow free access, such as Life in Lane, Radiopedia, Autobullets. And also, we can easily download all the applications to our mobile phone or iPads. And here are some examples that are widely used among healthcare workers in ED. In conclusion, social media plays an important role in emergency medicine educations. Of course, there are pros and cons, but I believe that effective learnings can be achieved if it is being utilized wisely. Here, I'm going to end my presentation. Thank you very much.